So what I'd like to start with, as far as questions go, is what does patient-centeredness mean? Why is it all of a sudden an issue that we need to pay attention to? And then we'll get to kind of where it's going. And I'd actually like to start with you, Jason, because I know you have your specific definition.
Yeah. When I look at patient-centeredness, I really reframe the conversation to one of patient experience, and that's the term that we use at the Barrel Institute. And we actually have worked with a number of healthcare leaders around the country to define what that is really now around the world. As a simple statement, it's the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. And those four elements are critical because when we look at it, it is every single interaction. And we're very careful to say that it's not just the moment someone shows up to Dan's hospital parking lot that the experience begins, or the minute they get discharge instructions and leave UCLA. But it's well before they ever experience those institutions and they know about them to well after. And that's a critical piece about the fact that every interaction has some play there. But more importantly, it's actually grounded in the culture of organizations. I think you see a lot of that in Joseph's books. Well, I think we'll have a chance to talk more about that. That healthcare organizations today are people delivering care to people. That's what we do. And I think, Bob, as you just mentioned, the great work that MPTF does, it's exactly the essence of your message. It's people caring for people. And so it's the behaviors, the values of the system, and the infrastructure that we create. Dave's shop is a perfect example of that it's based on that kind of idea that's most fundamental. And then it ultimately, at the end of the day, is about patient perceptions. I know we complain about surveys and all these other things, but we are, as we all raised our hands, patients. It's our perception that equates to the experience that we have. It's what we think. It's how our family members have been treated. It's what I observed the nurses do with my newborn 6 weeks ago to make me feel either confident or petrified that they could hold my child that way. I thought he would break. But I mean, those are the things that are key. And then it is to the point that it's across the continuum. It's not just clinical, but it's really across all the touch points that we have in the care system. The palliative, the home health, the reservation systems, the billing folks that call afterwards. And all of that stuff, to me, plays out in that conversation of patient-centeredness. So I like to expand the definition to move it beyond sort of what I believe is the policy cachet discussion of patient-centeredness to something more critical in involving all those voices in the conversation.
My original work was as an organizational development specialist in healthcare in the 80s, and we were talking about predominantly in that time frame clinical outcomes. We were looking at consistent service delivery, so our focus was on executing a service template and making sure we did all these things transactionally. We were very transaction oriented, and we were all designed to create the best clinical outcomes we possibly could for people, and that was terrific. But I think over time you can lose the patient as you focus on eradicating the disease. And so I think what I look at patient-centeredness, I think the Barrel Institute has the best going definition. They pulled together a think tank of great leaders in this space and have really come up with those key ingredients, whether it's interactions or perceptions or continuum of care or culture. So I would never want to challenge that definition. I just think in the end, can you really center the entire healthcare system around the patient? I'm not sure you can. There are very sophisticated, complex service delivery challenges going on in this industry. So for me, to just keep focused on the patient, let alone centered around the patient, would be a key element. For me, it's the totality of all the things that Jason just talked about, but it's to what end? What can we do with the limited resources we have that will improve the quality of life for patients? And for me, a lot around activating the patient to be a partner in their overall health care.
On the front line, what we're trying to do in our system is to say, are our processes and structures of how patients interact with the healthcare world the right ones? And let's just go back. How many of you have had to go through a hospital experience where every department you went in, you had to re-register and give them the same information? And that's not a good patient experience. We ought to be able to capture the data in our computer systems, and that should be it. So how do we work in our structures to get the patient's experience to be simpler, to understand how to navigate the system? But it goes beyond that. It's about how do we talk to our patients when they're in. We sometimes use a lot of acronyms and big words, clinical words. Our doctors do the same. And we need to change our language so the patient understands and feels comfortable asking the tough questions. Very often a doctor will walk in and just say, Mrs. Jones, here's what we're doing today. here's what we think you have, and that's it. And the patient has 1,000 questions, doesn't feel empowered to ask those questions. So we have what we call as patient navigators in our system for the patient through their whole experience, not just in the hospital, to help them understand the terms, to help them ask their questions and answer them, and direct them to the right resources on a timely basis so that their experience is much more positive and they feel that they have some empowerment over their care and their treatment plans.
We just recently did a paper, just came out in the last few weeks, Voices of Patients and Families, and this panel of 18 active patients, family members who've had pretty tragic or interesting healthcare experiences said that the biggest challenge for patients these days is to find their voice. That the healthcare system isn't structured in order to provide us the voice to engage in our care in a way that's effective. And what you find is, and I guess a lot of their mantra is nothing about me without me. It's a nice phrase, right? But I mean, it makes sense. And I think back to the point that Dan was making, once people understand the elements of their care and they actually are able to find their voice in a constructive way, you are finding, I think, what Joseph was saying, the ability to drive down cost, to actually reduce length of stay, to find more wellness. And I love what Dean Trottel was saying earlier, that we're moving from a culture of sickness to a culture of care. Now, obviously, we want to move to this culture of health, but I think that's what patients are longing for. And I feel guilty sometimes sitting here talking about patients in the third person, because again, we all raise our hands and we are. So when we think about what we would want from that standpoint, I think being able to make choices, informed choices, and be active participants in our care would ultimately help us manage the broader systemic issues that we're facing in healthcare from a cost, quality, safety, service standpoint in totalis. And I think that helps us drive the ultimate outcomes in a lot more significant ways.
But it starts with one-on-one patient care. That's the beauty of this industry. In the end of the day, for all the cost stuff we talk about, the non-specifics of care have a lot to do with clinical outcomes. You know, if I felt you really gave a darn about me, has a lot to do with whether or not I'm engaged.
The story I always share is about the blueberry muffin, which is like the short version is, building engineer is walking down through the lobby of his shop. A woman was in the waiting room, like a lot of us are, waiting for a loved one to go through surgery. She gets the news of the surgery. She finally feels like she can eat, and all of the emotions swell up. She's excited, she's hungry, all these things. She goes to the machine, she puts in her $1 to get this muffin, and what does it do? Zzz, right? It eats the muffin, eats the $1. She's standing by the machine crying, all this stuff. Building engineer comes by, sees the woman crying. Building engineer, light bulb. His name's Frank. He's trying to go, make sure the light bulb's changed. Sees her, asks her, what's the matter? She responds with the whole story of the diagnosis. It happened when he was diagnosed, all the way through. Ultimately, I was trying to get a blueberry muffin. The machine didn't have one, so I was going to get a cheese Danish instead. It ate my money. He said, hold on a second, ma'am. Gets on the radio, calls the back of the house. And as these two guys described it, Frank and Tom, I'll use their names, all of a sudden you hear chariots of fire blaring like, and around the corner comes the other building engineer. And he runs up to the lady in his old coveralls with Tom on there, and he says, ma'am, we want to make sure you're taken care of at our facility. And we heard you were hungry and wanted a blueberry muffin, so here you go. And here's your $1 back. Now, that wasn't something that the CEO made those folks do. Now, I think the organizational structure, the leadership framework that enabled people to make those choices is key. So whether your leader is a gung-ho pounding, we must be patient-centric, we must work on patient experience, whatever the word is that they use, and I think you're a great example of that. If you have people that can begin to make those choices, those stories permeate. There are a ridiculous amount of competing priorities that you have to sift through every day, fundamentally knowing that patients are key. But if you create the space for those things to happen, that's, at the end of the day, sort of the fundamental opportunity. And holding that space as a leader becomes critical. And then that's where the groundswell comes from. So understanding that leadership is key, understanding that it's actually the lack of focus that is the key roadblock to that, and then how you begin to work through that to provide the space for your people to make those right kind of decisions.